Good day, my name is Sheila May Oxtero from the University of the Visayas, Mean Bachelor of Science in Nursing 1. So for today's video, I am going to demonstrate the health assessment, which is the examination of head and face. First is inspect the patient's head and face. There should be normal in size, shape, symmetry, and contour. Second is, look at the hair and note distribution, quantity, texture, and color. It should not be too dry or oily and should not contain scales or nets. Next is, palpate the patient's scalp. It should be pink, mobile, and free of lesions. Is it normal if you feel bony permanences in the forehead and the sides of the pharyngeal bones and behind the ears? So next is, palpate the temporal arteries using the tips of the middle and index fingers. The pulsations should be equal. Next is, listen for breeze over the temporal arteries. You should not hear any. Next is, palpate the frontal. Press your thumbs under the inner aspects. Next is, palpate the maxillary sinuses. Press under the zygomatic bone. Lightly percuss this area. Palpating and percussing the sinuses should not cause pain or tenderness. If they do assist the sinuses, order with transillumination. Next is assisting sinuses with transillumination. Move the fingers to the patient's temporomandibular zones as you palpate with the middle finger. Instruct the patient to open and close his mouth. Joints should move freely and painlessly. This assists joints mobility and motor function of the trigeminal nerves. Okay, sir, can you open your mouth and close? Thank you. Instruct the patients to raise and lower his eyebrows, bare his teeth, smile broadly, puff out her cheeks, and keep her mouth closed as you try to open it. Sir, can you raise your eyebrows? Lower, raise, lower. Then, and can you bare your teeth? Okay, thank you. Can you do smile broadly? Okay, thank you. And then, can you open your mouth? Close, open, close. Thank you. Movements should be symmetrical. This is to test the patient's facial muscles and motor portions of the facial and trigeminal nerves.